Welcome to the OPTICROSS preparation setup. In this video, we will walk you through the techniques and steps to prepare the permanent sled, MDU, sterile bag, and catheter for use, as per the instructions for use. Place the sterile bag over the MDU and sled. Placing the sterile bag over the MDU and sled requires a sterile and non-sterile operator. Using sterile techniques, the sterile operator should unfold the bag, ensuring the "this side up" sticker is facing upwards. The sterile operator should then slide their hands into the most inner folds of the sterile bag. Have the non-sterile operator place the MDU into the bag, aligning it with the "this side up" sticker. The sterile operator will grab the MDU and ensure it's secure in their hands. Using the white strips, the non-sterile operator can then unfold the bag to its full length, covering the cable of the MDU. Attach the bag's faceplate to the catheter connection nose of the MDU, ensuring there is no material trapped in between. The MDU and sled are now ready for use with the catheter. Let's move to the flushing of the catheter. This portion of the preparation requires all the accessories provided with the OPTICROSS catheter and heparinized saline. Flushing of the catheter must be performed using sterile techniques. Remove and discard the blue shorting plug from the catheter connection if the catheter comes with one. Fill the 3 cc and 10 cc syringes with the heparinized saline using a pumping action that helps release air bubbles that might be present in the syringes. Connect the syringes to the 3-way stopcock and extension tube, ensuring all air is expelled. Retract the movable imaging core completely to the proximal position by carefully opening the telescoping shaft. Connect the extension tube and syringes to the catheter. The 10 cc syringe can be used to refill the 3 cc syringe as needed. Using slow, steady pressure, flush the catheter twice to purge bubbles. You want to see a drip of liquid from the tip of the catheter hoop, not a spray. Use the 10 cc syringe to refill the 3 cc syringe for the second flush. Carefully transfer the catheter and syringes to the patient table. Remove the sticker from the catheter connection. Align and connect the catheter hub to the MDU until it clicks into place. Tug on the catheter hub to ensure it is secured with the MDU. Ensure that the system has recognized the correct catheter. Carefully remove the catheter from the sterile hoop dispenser coil. Activate imaging by pressing the button on the MDU and then carefully close the telescope using both hands. This step is key to help reduce the occurrence of air bubbles and image dropouts when the catheter is being used. The system will show bright concentric rings, confirming that the catheter is functional. Turn the imaging off. Carefully advance the MDU to the forward position on the sled and clip the proximal end of the telescope to the sled. Ensure the 2 on the bag is aligned to the sled clip. Perform a final 3 cc flush of heparinized saline. The catheter is now ready to use, and follow the prescribed steps in the instructions for use to introduce the imaging catheter into the guide catheter. Proper preparation setup reduces the probability of air bubbles in the catheter.